You know what? It's Rally for Red Day here at ABC 15, and as always, we partner with Mayo Clinic to bring you the latest in heart health. If you're planning on having any surgical procedures done, should you have your heart evaluated first? That's what we're talking about this morning. Dr. John Lynch is a Mayo Clinic cardiologist, and he's here to explain really who should take that extra precaution. Good morning, Dr. Lynch.
Good morning, Terry.
Well, thank you for joining us, because this is really, for some people, a very important step that they must take. But really, who should have a cardiac evaluation before surgery?
Well, it's a good question, and then we see a lot of our consultations are based on those types of patients that need to come forward for surgery and they want to have some kind of clearance beforehand. It's usually the patient that has is a higher risk going for kind of a moderate or a higher risk type of surgery. So we evaluate the risk of surgery, management issues that would be involved, changing of medications, those types of things, and looking at conditions that might require future care, future directions.
I see.
So it's usually the patient. I do think the type of surgery is important that we look at.
Right.
You go for cataract surgery or endoscopy or certain types of procedures, you probably don't need any type of screening. We don't need to spend money in that area.
Okay, that's good to know.
And people who can't really exercise, the person who particularly can't walk up a flight of stairs or walk 4 blocks, for example, and have a limited functional capacity, those people should probably be evaluated if they're going on for some more type of complex surgery.
And even just a complex surgery. I mean, if you are already expressing some of those symptoms, maybe extra precaution should be taken.
Well, I think that's where the management issue would come in. So we would look at a risk profile of an individual. We look at whether or not they have a history of coronary disease, heart failure, history of stroke in the past, diabetes, renal function, and then their exercise capacity. So we kind of add up those risk indexes, and depending on where that falls, we can then decide how aggressive to be in trying to manage these patients.
I see. And what types of testing would you do for somebody who is required to have some pre-cardiac testing?
We usually like to do some kind of functional tests. So if they're able to exercise, and again, we talked about a lot of these people can't exercise. So we would do a pharmacologic test either by ultrasound or by nuclear testing. I would prefer ultrasound because of one, it doesn't require radiation. 2, I can kind of tell when a person gets into trouble versus just a positive or negative test, like a nuclear test. I see.
And is this a pretty extensive evaluation? Is this something that
requires
multiple days and multiple tests?
It takes about an hour and a half.
Oh, really? Okay. All right.
It takes about an hour and a half.
That's good to know. What advice can you give folks who are watching right now if they, if something could happen to any of us at any given time, and it's
unexpected.
Yeah, absolutely. It's so important to keep our bodies in check. What would you say to people? Just do this now and do it always, and you're good to go.
Probably many of the things that we don't do that we just take for granted. I mean, we should probably all eat better. We should probably be active and move. Try and get more physical exercise. Obviously, stop smoking if you can do that. And know your numbers. When we talk to people and you'll ask them, what's your cholesterol? They have no idea. What's your blood pressure? They have no idea. So knowing those numbers, your blood sugar, your cholesterol, your blood pressure, all becomes pretty important.
Yeah. It sounds like we should do that anyway.
Well, it's pretty much common sense. Right.
All right. Well, Dr. Lynch, thank you so much for joining us.
Pleasure. Thank you for having me.
Always good to have you here, and good, solid, sound information. So let me tell you how you can make an appointment. Should you need an evaluation with a Mayo Clinic cardiologist, call this number right here, 480-301-8200. And don't forget, ABC 15 is teaming up with Mayo Clinic for the Rally for Red campaign. Each month, we'll give you easy-to-follow recipes and ideas to help keep you and your loved ones' heart healthy. To learn more and get our Rally for Red reminders, sign up at abc15.com/rallyforred.